Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. 36 state governors unanimously agree to revive their COVID-19 protocols and collaborate with the NCDC to take appropriate and immediate actions to flatten the coronavirus curve. The National Agency for Food and Drug Administration and Control, NAFDAC, approves 2 more COVID-19 vaccines, Moderna and Sputnik V, for emergency use in the country. And United Arab Emirates government announces COVID-19 safety protocols for 6 days Eid al-Adha holiday, starting on Monday. The head of the World Health Organization's Essential Program on Immunization says the COVID-19 pandemic has set the world back a decade when it comes to the progress reached by childhood immunization. According to official data published by WHO and UNICEF, 23 million children missed out on basic vaccines through routine immunization services in 2020. That is 3.7 million more than in 2019. Meanwhile, 48 new confirmed cases were recorded in Nigeria. That's according to the Nigeria Center for Disease Control. Let's take a look at the report.
After a week of reporting more than 100 cases of infections, the latest figures from the Nigeria Center for Disease Control in the last 24 hours have dropped as the agency announces 48 infections reported from 7 states and the FCT. Ondo had the highest numbers with 14 cases. 10 cases were reported from Oyo. Gombe reported 6 cases. 5 cases were reported in the FCT, while Ogun had 4. Other states include Delta, Ekiti, and Rivers State with 3 cases each. The latest update also includes 0 cases from Plateau, Sokoto, Nasarawa, Kano, and Kaduna, and no data from Lagos State. Nigeria now has a total of 168,915 confirmed cases. 12 people have been discharged in the last 24 hours, raising the total number of recoveries to 164,652. There were no reported casualties, leaving the fatality toll at 2,125. Presently, there are 2,138 active cases in the country, while over 2.3 million samples have been tested so far. The latest update by the National Primary Healthcare Development Agency shows that Nigeria has successfully vaccinated more than 3 million eligible persons across 36 states and the FCT. In Africa, there are over 6 million confirmed cases and more than 154,000 deaths on the continent. Globally, more than 188 million cases have been confirmed, while deaths have surpassed 4 million.
Which has a lot of great stuff for you. All your favorite shows.
Students of the University of Lagos Akoka leaving their halls of residence following the directive by the university's management. A visit to the school by our correspondent today shows that many students have since left the premises after reports captured in the institution's campus paper claim that the decision follows a spike in COVID-19 cases. The institution also admitted to seeing an increase in the number of patients presenting flu-like symptoms, which are similar to COVID-19 at the University of Lagos Medical Center. The university says leaving the premises is a measure to avoid escalation of cases on campus.
All your favorite shows.
And to prevent a third wave of COVID-19 infections in the country, the Nigeria Governors Forum, NGF, is calling for unanimous action. The group made the call after receiving an update from the Lagos State Governor, Babajide Sanwo-Olu, on the recent spike in confirmed cases. Following the update, all state governors have agreed to revive their COVID protocols and collaborate with the Nigeria Center for Disease Control to take appropriate and immediate actions to flatten the curve. The forum will interface with the Presidential Steering Committee on COVID-19 to speed up processes required for the delivery of additional vaccines. In the meantime, the National Agency for Food and Drug Administration and Control, NAFDAC, has approved 2 more COVID-19 vaccines, Moderna and Sputnik V, for use in the country. The Director General of NAFDAC, Professor Mojisola Adeyeye, announced at a news conference in Abuja today that the approval is for emergency use.
Yes. Then the second question. NAFDAC is announcing the approval of Moderna and AstraZeneca vaccines and the approval of Sputnik V vaccine. Moderna and AstraZeneca that we are approving now, the AstraZeneca we are approving now is from Korea because India has stopped sending anything out because they need it for their people. These two vaccines have received WHO emergency use listing and were given expedited approvals. Sputnik V is yet to receive the emergency use listing approval, and therefore we subjected it to full 6 months review by NAFDAC. The product has a shelf life of 6 months when stored at -18 degrees centigrade, or 3 months when stored at 2 to -8 degrees centigrade. The agency did a thorough assessment for each vaccine and were found to have the quality, safety, and efficacy attributes, with the benefits far outweighing the risks.
And Africa has recorded a 40% rise in COVID-19 deaths this week compared with last week, as infections and hospital admissions have jumped and countries face shortages of oxygen and intensive care beds. The surge has been driven by public fatigue, with key health measures aimed at curbing the spread and an increased spread of virus variants. WHO says Africa has seen one of the world's fastest surge in cases, with an additional 1 million over the past month.
As this surge sweeps across Africa, we're witnessing the brutal cost in lives lost. Deaths have climbed steeply for the past 5 weeks, jumping 40% in the past week. This is a clear warning. Our hospitals are at a breaking point. In all, 153,000 people have sadly died. This COVID-19 resurgence is the fastest the continent has seen. New cases have increased for the 8th consecutive week, and 18 African countries are now in resurgence.
Now, household seroprevalence studies are taking place in some parts of the country in partnership with the NCDC and the Nigeria Institute for Medical Research, NIMR. Now, the first of its kind were conducted between September and October 2020 in 4 states, which results revealed that the prevalence of the SARS-CoV-2 antibodies was 23% in Lagos and Enugu states, 19% in Nasarawa State and 9% in Gombe State. Now, that was interpreted to mean that as many as 1 in 5 individuals in Lagos, Enugu and Nasarawa State would have ever been infected with the SARS-CoV-2, while in Gombe the proportion was about 1 in 10. Well, joining us for more on this, Senior Epidemiology Advisor to the NCDC Director General, Chair Scientific Advisory Group of the Nigeria COVID-19 Research Coalition, also Extraordinary Professor of Epidemiology, University Western Cape, joins us now, Professor Himario Igumbo. Thank you for joining us on the program.
Good evening. Thank you, Millicent, and a pleasure being on your show.
Thank you. First, I'd like you to react to, some of the top stories coming in today, and that is the decision of all the state governors to revive the COVID-19 protocols and collaborate to take appropriate and immediate actions to flatten the curve. Can you confirm to us if Nigeria is experiencing a third wave?
Right. Thank you, Millicent. We certainly have seen a tick up in the number of cases, confirmed cases through our surveillance systems in the last while. It is very apparent that the pandemic is still active, and Nigerians truly need to be aware of the risk and take responsibility. So I do think that the governors coming out is truly coming to terms with the facts. We've got to face the facts here. We can't just bury our heads on the sand. There's a rise in cases in Nigeria, and it seems even more imminent that more cases will be seen in the next couple of days, going by what we see in countries across the world, and more so countries in Africa. And this risk is even higher with the Delta variant of the virus, which is known to be more transmittable. So we think that we certainly have a window of opportunity here to prevent the surge. And, it's really good that the governors have come up responsibly in telling us to adhere more stricter to public health and social measures.
But as much as we need to do that, the science isn't telling us that Nigeria is in a third wave, is it?
Well, like I have put it, we define waves of the epidemic as a rising surge in numbers. We certainly saw numbers dwindling from April, May this year, which in our parlance reflected, the end of the second wave, as it were. But in the last couple of days, we've certainly seen uptake. Treatment centers that had 0 patients are beginning to see patients come in. In clips we saw just before your show started, schools around Lagos area are beginning to report a fair number of cases being picked up. We need not wait to have very high levels of infection and to begin to take action, especially in the wake of increasing number of cases as we're seeing more recently. If we can nip it in the bud soon enough, we're at better place in controlling the epidemic.
Let's talk about the work you're doing in Delta and other states. I believe you're taking samples of households on the seroprevalence studies. I mean, how are they reacting and what are the numbers telling you?
Well, thank you, Millicent. Building on work we have done in a couple other states, we started in Lagos, in Enugu, Nasarawa, and Gombe State last year. And early this year, we were in Sokoto, in the FCT, and in Kano. We have now come to Delta State and to again undertake studies to find out the levels of antibodies across all 25 local governments of the state. We enumerated about 34 areas, and so far we have been able to recruit in excess of 2,000 individuals. In these individuals, we have tested them for COVID and drawn blood samples to be able to pick up antibodies for the SARS-CoV-2 virus. And we'll be testing these. We're still in the lab, and we've been very happy with going into people's homes and, kind of talking to them and inviting them to participate. And it's been quite good to see the response we have got. And we're looking for the next couple of days and to see that we get an adequate number of people who would volunteer to be in the study and get their samples taken. We are also in the households learning about some of the behaviors they perform related to COVID and asking questions too about their predispositions to taking the COVID-19 vaccine. So we're learning a lot just being in the field in Delta State, and we've been very pleased with the participation so far.
And hopefully when the results come in, you'd also share them with us and with Nigeria. We appreciate your time on the program, Senior Epidemiology Advisor to the NCDC Director. Thank you so much, Professor Mario Gumbo, for joining us on the program.
Thank you, Millicent. It's been a thank.
Well, still to come, UAE residents to remain cautious ahead of the forthcoming holidays. We have that and more when we return. Welcome back. The United Arab Emirates government on Wednesday announced that over 1,500 new cases of COVID infections alongside 1,481 recoveries and 4 deaths have been recorded. Although it is one of the top most vaccinated countries with nearly 67% of its population fully vaccinated, it's urging residents to remain cautious ahead of the forthcoming holidays. Our correspondent Maiwa Adiguke tells us more.
UAE government has announced protocols for a 6-day Eid al-Adha holiday starting Monday. During the ceremonies, mosques are to open 15 minutes before prayers and close immediately after, while sermons will also be limited to 15 minutes. Close contact between worshippers is prohibited, and they will have to bring their own mats for prayer. With the Delta variant already recorded in the country, government is concerned infection rates may increase significantly after the holidays.
And a lot of people feel like COVID is gone. The UAE has the highest stats when it comes to vaccinations. But even with vaccinations, they still advise you you still need to be careful. You still need to wear your masks. The holidays are coming, and they're very, very strict on the regulations. It's a Muslim country, but still they're not going to allow gatherings and a lot of things. We really need to be careful. Trust me, I was down for 3 weeks. I couldn't do any productive economic activity. So I don't even wish this on my enemy at all.
Ifeanyi has just concluded isolation after contracting the Delta variant.
The studies coming out is suggesting that with the Delta variant, it's giving a lot more severe disease, a lot more hospitalizations, and a lot more attack on the lung cells as well. So certainly that's why it's falling into the variant of concern. Now, again, we're going to adopt the same measures. Social distancing, masking up, vaccination. We have seen across the different studies that are coming out that vaccination does play a huge part in trying to mitigate the spread and the impact of the COVID-19 infection.
After Eid al-Fitr in May this year, the average daily cases reported was 2,000, an increase of 60%. Daily deaths also increased by 100%. To reach 6 fatalities.
Particularly, one of the recommendations that has come out recently as well is if you're going to visit family, friends, especially with reference to people who are vulnerable, comorbidities, people who can be severely affected by the COVID infection. I think the recommendations coming out from the health authority is for us to get tested and just make sure that we're not infected with the COVID, so we're not carriers of the virus to at-risk and vulnerable groups as well. So yeah, the usual stuff about ensuring that we're complying with infection control measures to try and stem the spread of the COVID-19 infection.
Government has also advised against the age-old tradition of sharing meat, food and cash gifts in a bid to mitigate any significant rise in infections. From Dubai in the United Arab Emirates, Mayowa Adegoke for Channels Television News.
And joining us right now from Dubai is Ifeanyi Abraham, whom you just seen in that report from our correspondent Maiwa. He is the founder of Find Black Experts and has recently recovered from the Delta variant. He joins us now to share his experience. Ifeanyi, thanks for joining us on the program.
Thank you very much for having me.
All right. Now, how are you doing, having recovered from COVID-19?
Well, just back from work. It's just been day 3 back. I was totally out of the office for 3 weeks, isolating at home, still taking things easy, still have a bit of a cough. I've lost a lot of weight and still have some bit of chills. So I'm just taking things easy and trying as much as possible to get some rest. With the upcoming holidays next week, I'm really just going to take that opportunity to boost my immune system, rest at home as much as possible. That's how I feel at the moment.
Now, based on the symptoms you heard about COVID-19 when the pandemic started, 2019 into 2020, were they similar to what you experienced?
Yes. So I experienced most of the symptoms that I read about. For 2 years, I kept reading about the symptoms, kept going about trying as much as possible to avoid getting the virus, and it sprung up on me in a very surprising way. The very first symptom I experienced was increased body temperature and severe headache. It came to me on a Sunday. I couldn't do anything. I was in bed all day. I'm AA. I'm typically like a malaria carrier. So my first assumption was that this was a bout of malaria, even though the UAE has largely kicked out malaria. But my first attempt was to try to treat malaria. But I started seeing all the other symptoms, loss of appetite. Like my appetite was almost totally zero. shortness of breath. I wasn't able to smell things properly, general body weakness. I started feeling weakness in my joints, my ribs. It was a totally horrible experience. So most of the symptoms that have been described, I experienced them all over the course of 3 weeks. So in terms of my initial experience, I first started feeling the symptoms on Sunday. My initial instinct was to stay at home, take the malaria meds, which were helpful, to be honest, in terms of managing the temperature. But in terms of the weakness and all the other symptoms, it wasn't really helpful. A couple of days later, I finally heard that one of the people I had been in contact with had caught the virus. This was what prompted me to go do a test. And then I got the results that I was positive. Then I started following the laid down guidelines or the advised things when it comes to handling the virus.
So in terms of isolation, what was the experience?
Okay, so I live in Dubai. So different Emirates have different processes from an isolation perspective. Dubai, the attitude is largely self-responsibility. We're at the point where we know we're living with this virus, so everyone just has to be careful. So Dubai gives you 3 options. Once you receive a positive result, when you receive a message or a call from the Dubai Health Authority, they ask you whether you can self-isolate at home, whether your home allows you to self-isolate and stay away from people, or whether you need isolation in a hotel or you need isolation in a hospital. Both options, paid options. Luckily for me, I was able to self-isolate at home and stay away from people. Requirements for that is having your own private room or apartment, having your own personal washroom and kitchen. For Abu Dhabi is a lot stricter from an isolation perspective because the person that got the virus from eventually lives in Abu Dhabi. So the Abu Dhabi has options for isolation centers. They have proper isolation centers, which you don't have to pay for. COVID test is also cheaper in Abu Dhabi, so you can run as many COVID tests as possible. In Dubai, you have to download an app to track yourself, to get regular updates and information. They tell you early enough how many days they expect you to need to quarantine in time, and after that, you go in to get tested to see whether you have the virus is out of your body. The major thing that they advise is to take things that boost your immune system. From their perspective, simply vitamin C, vitamin D, zinc, magnesium. I added extra things. I was having regular steaming baths with ginger, with aboniki balm, and then I was always having ginger water and garlic as well. This was very helpful. These are not part of my general lifestyle. The only thing I was pretty much able to eat was fruit, smoothies. Making as much smoothies as possible was a very difficult ordeal with all the weakness that I had. The only food that could practically enter my body was pepper soup, so I had to keep ordering for pepper soup. I was not able to eat any other thing. Like I would have bouts where I felt like throwing up. Yeah.
Oh dear, we are so sorry that you had to go through that. But we'd like to thank you for joining us. I just want you in 30 seconds, and this is, haven't gone through it, haven't survived it. How do you look at, this is still the pandemic era, life after, in terms of the measures now?
Yes, and my advice to everybody is please try as much as possible to do things that protect you from the virus. The general government directives around masks, around social distancing, having these small sprays where you can spray your body when you've had contact with people, avoiding putting your hand directly to your mouth or your nose, which has been found to be the easiest way for this to pass. Especially with this Delta variant, the speed of transmission is really crazy. So we need to be extra careful. Yeah.
We appreciate your time. Thank you so much. Ifeanyi Abraham is the founder, Fine Black Experts, joining us from Dubai. Thanks a lot. WHO Director General Dr. Tedros Ghebreyesus has called on China to be more transparent with investigations into the origin of the coronavirus pandemic, as they were hampered by the lack of raw data on the first days of spread in the country. The WHO-led team spent 4 weeks in and around the central city of Wuhan with Chinese researchers and said in a joint report in March that the virus had probably been transmitted from bats to humans through another animal.
According to the WHO team that participated in the investigation, introduction to the coronavirus through a laboratory incident was considered to be extremely unlikely pathway, but countries, including the United States and some scientists, have not been satisfied with the explanation.
We are asking actually China to be transparent, open, and cooperate, especially on the information raw data that we asked for at the early days of the pandemic.
Meanwhile, the World Health Organization says Africa recorded a 40% rise in COVID-19 deaths this week, compared with last week, as infections and hospital admissions have jumped, and countries face shortages of oxygen and intensive care beds. The WHO says Africa's case fatality rate, the proportion of deaths among confirmed cases, currently stands at 2.6% against the global average. Hundreds more bodies than usual are being taken for funerals every day in junta-led Myanmar as a new wave of COVID-19 sweeps through the country. The accounts from different parts of Myanmar point to the daily tolls being higher than those given by the Health Ministry, which recorded 145 fatalities on Wednesday. Finally, Britain's Prime Minister Boris Johnson says the worst of the coronavirus pandemic would be behind the country if it is careful, meaning that the economy could recover like a coiled spring.
With every day that goes by, we build higher the wall of vaccine-acquired immunity, a wall that is now higher and stronger in this country than almost anywhere else in the world.
His comment comes as medics fear a surge in flu and other respiratory viruses could put pressure on people's health and the NHS this winter.
Stay safe and continue to take responsibility. Our website, channelstv.com, has more updates, also a better understanding of the pandemic. That's the program. Thank you for watching. I'm Millicent Walker. Stay safe, everyone.